You're watching TVC Breakfast. So, on this segment, we're looking at the risks that Nigerians face with all of the flooding that has taken place and devastated the communities in many states of the Federation. We have over 600 people who have lost their lives, and we have more than a million or 1.5 million people displaced so far, and thousands of homes and communities destroyed. This is what we've been talking about. And we're talking about the health risks. Dr. Tuime Bawandu, public health consultant, is here with us in the studio. We've been looking at this issue. It's good to have you join us still. Now, Sam was asking you about the details of
the diseases and so on. And then you spoke about the presidential responses, the candidates and so on. I think Asiwaju responded to it last week during the inauguration of the Women's Council when he spoke about the fact that there will be efforts done to alleviate the problems of flooding in the country. Lagos itself is an example. You may have to speak to that in the course of this discussion, how Lagos has been able to handle this kind of thing. Because what happened in Lokoja could easily have happened in Lagos if we didn't have the situation and so on. So, but I want you to break down these diseases because you mentioned the number of them and how do they really appear? How do they call? How do they affect people because of flood situation?
The first, because of the emergency situation, drowning is common, especially among the extreme of the ages. Very young and very old because of being infirm and cannot really move around. So at least the system must be structured to a way to give help to those people who are actually challenged, in terms of strength. Secondly, because there's no water to drink, you can't then drink the water from the flood. Provision of water supply becomes very key. That's the fundamental. So, because
water and sanitation.
That is cholera. This man, Coleridge, water everywhere, not to drink.
Cholera is there. Of course, cholera is a very fatal disease. Vomiting and stooling. Of course. Normally, there are vaccines for cholera. What should have happened is that as you're seeing that flood, and as health workers are moving to that community, they give those vaccines. Typhoid is another common thing, of course, which is quite common in our environment. There are orophycal diseases. They come from feces, enter the water, people then drink it. So water supply for them, cholera, typhoid, they're very, very common. Then even paratyphoid, they're similar to that, okay? Then there are skin problems that they can actually have, okay? So these skin problems, eczema, dermatitis, because there are also chemicals flowing from farm, from underground, running with the water, and people are actually wading inside the water. So it's important that even if they have means of soap, they have to actually keep washing their legs whenever they have reason to stray inside the water, and then they should keep away from the water as much as possible while the flood is still resting on the ground. So then, of course, there will be a place for them, like a camp where they can stay to wait for the water to recede, and then that is where you have to actually arrange a mosquito net for them because of increased cases of malaria. And then by providing water, sanitation and hygiene for them, you will have dealt with a lot of those diseases that they may come in contact with. So quite a lot of them, in some other parts, that's not common in Nigeria though, but you have poisoning from heavy metals, which can either enter their skin or they drink. Some of them have no choice than to drink those water. So essentially, what we need to do is actually the public health discussion, integration of even into any of our emergency services or humanitarian care. We must integrate deeply the health component. The health component must be integrated so that we can pre-plan all these things, look for these things, and then ensure that we don't keep losing life. 700, you are saying 600, but it's 700. More than 700 people now dead from this, and that is really a disaster that shouldn't have happened.
And then you're talking about chemicals. We have in this country, we are very careless about throwing chemicals on the floor.
Even on the gutters.
On the gutters.
So the effluent of some factories are thrown.
All the effluents of industrial effluents.
Yes,
they just threw them there.
Oil, diesel,
the diesel, vulcanizer will put a lot of engine oil on the floor, on the ground.
Just move around our riverine community.
Yes.
You see all sorts of things floating. All sorts. Of course, and that's what flood does. Just bring out all this things from where they are and throw it on the, and then of course it's a danger to the ecosystem. But the fact is that we humans, we have mandate to protect the ecosystem, to protect ourselves, to protect the planet. As the Anthropocene activities increases and we're messing up the planet, the climate will respond.
Explain what is that, Anthropocene?
Then the human activities,
the
human activities on the climate, all the things we're doing, felling trees, cutting this, blocking gutters, those are our activities.
They have consequences.
Consequences, burning all sorts of bushes and all those things. All this will have effect on the
That's the difference between flooding here and flooding in maybe New York and so on, because those people are taking care of the environment in the first place. So the water is not as dangerous as the one we have
in reality, when the flood is to come, or when hurricane is to come, or earthquake, they know months, and everybody's ready. Immediately the thing is hitting, they are responding health-wise, they are responding infrastructure-wise, education, everything, response comes, light is restored, road is built back, and then people are, before you know it, after a few days, we are back to their work. So we must be able to step. These things are not difficult in reality. It's just for us to pay attention to it. When we're doing the climate predictions, seasonal climate prediction with Nigeria Meteorological Service Agency, by February, we should know that this is what we are going to face. How are we going to plan? It's a multi-sectorial thing. It shouldn't be if you be left with the NEMA or left with humanitarian affairs alone. So, and then unfortunately, we still have to use a lot of our primary health care centers. That's where our hope is now. Because the criteria, the challenge we're having with human resources for health, the challenge we're having even with the processes, everybody's on strike here, strike there, nobody wants to work. Everybody's just focused on how to satisfy his stomach. So we need to use that local primary health care center, strengthen them to respond to some of these emergencies we're experiencing. We can't be lighting, fire quencher every time. We know these things are going to come.
Yeah.
We know.
The last time we had our primary health care centers function optimally was under Professor Olukoye Ransom Kuti when he was a Minister of Health sometime in the 90s. And that was the peak time where health was very robust in this country, especially when it comes to primary health care. But talk to us from the window of food security, how this compounds the situation. Because the point there is, we're seeing a situation where, like some of the visuals we showed earlier, there's water up to the level of the roof of houses. Farmlands are washed off, where, of course, you may not come back to see anything on that farm anymore.
It's very challenging. Of course, you know that even before now, we have problem with Ukraine war, food supply, COVID, Ukraine war, food supply, now flooding. And Nigeria, unfortunately, we are number 2 in malnutrition, severe acute malnutrition that we need to deal with. There are crop failures, the price of food inflation, more than 20%, like you already pointed out. It's a critical situation already. Now, the few farmlands, 84,000 hectares of farmland wiped off. So that means that all those crops will be useless. So what do we do? So now we should be bracing up. Of course, normally I expect the government, I must commend Lagos State government because they're actually building food storage all over the country to warehouse food and supply to the people. Every serious government should be able to think about that we're having malnutrition in this country. Food inflation is going up. How do we respond to this? So that in reality, I've not seen a concrete, solution on how we're going to respond to the food insecurity and challenges that will follow this thing. And we're entering a season of festive season where food is key. So, and then money is not available, food is scarce, flood has come to take the rest of the food away. What do we do? Of course, government should step in temporary aid and ensure that, either by import or by any means to interface in the food supply system. Or else, by January, malnutrition will get worsened. The diseases there will be upsurge of those diseases. Of course, cholera, we've tried to battle it in the time past. If you are seeing a whole 33 states being affected in a matter, you know that it means that we may have, an epidemic of cholera if we don't do something about that. The easiest thing is for us to tell people how to deal with their water supply, the water they drink. Of course, a tiny water guard put in a bucket of water will solve that problem. Of course, supply that to them. Let them be able to educate them on how to get that water so that you can, relieve people of that challenges and even help the country not to face cholera by January or even by December.
All right, that's really an issue that government. The challenge sometimes is when everyone waits for the federal government on what they have to do or what has to be done. Yeah, nobody talks about what the state governments and even the local governments are doing.
Indeed,
or what they should do.
The strength of each of us should be at the local government. You understand, where they look at it and interface and do something, and people to even that micro planning at their level, and then help the state and the federal to do a lot of things. And even we as individuals, every time I come here, I keep telling people, don't be in a hurry to die. There are things you can do. You will die, don't worry. You will die, but why are you in a hurry? There are things you can do. For instance, that this is flooding. What else can I do? I can't drink this water again, but I can buy water guard, 100 naira or 200 naira, and put in my water and drink, and take special care while the flood lasts until it recedes. So we must be able to seek, lift our hand for it to be help, for help. But if we stand and say, I'm waiting for government and government does not come, what do we do then? So activities at our level, at the local government level, at the state and federal level. So, and each of us has a role to play.
It's very interesting what you said about we should not be in a hurry to die. It looks like Nigerians, the way we are constituted, we seem to be in a hurry to die, but we don't know that we're in a hurry to die. Now I remember the poem Dickinson.
I think our major challenge, for me, is that we focus too much on our belly. Yeah. We focus too much on our belly.
That's why we're in a hurry to die.
How to satisfy belly, how to satisfy sensuality.
Yeah.
The matter of heart, compassion, feeling, empathy. Yes. Run away from us.
But those are the things that will keep you,
run away from us.
They give you long life.
Yeah.
They give you joy and so on.
Indeed.
Yeah.
But part of it is also poverty. Poverty makes us desperate.
It comes back to the stomach.
It's a poverty of thought.
Stomach infrastructure we talk about. Well, I don't talk about real infrastructure. We have not changed infrastructure to stomach.
There's a concept called lagom in Sweden. It's just enough. If your food is this big and you've taken this, just enough.
It's just enough.
Just in anything, just enough.
Yeah. No, but the poor man wants to eat more because you don't know when the next meal is coming,
exactly.
So you want to grab everything.
Yeah.
That's what they call it. There's an alley cat. When I was in the US, I was trying to house sit for somebody. The person had a cat, and she said, "Look, Sam, this cat, I got it from the alley. The name of the cat is she called the cat doormat, because anytime she opened that door in the morning, the cat was always on the doormat. So she adopted the cat, but she discovered that the cat was always hungry. Anytime you have food, he wants to eat. He said, why? Because when it was on the alley, he didn't know when the next meal was coming. Yeah. So he always wants to eat and eat and eat. And so Sam, be very careful about this cat because it is always hungry.
Exactly. There's a lot of insecurities.
Insecurity.
The insecurity of the next...
because you say, okay, let me eat because let me feel it because I know that...
I don't know when next...
When the next time, maybe to do this time.
All right, let's go on a break, and then when we come back, we will look at the dimensions of where Sam started with the issue of doctors not being available, and that let's look at it from the brain drain and how that compounds the situation now where we don't have enough public health physicians and all of that. Stay with us.